Hi, in this video, I'll be talking about COVID-19 in people who are experiencing breast cancer. What a time in our world. It just doesn't seem to go away. COVID, when it initially hit, was so disruptive that when people had breast cancer, they found that they were sort of trying to get their needs met under this huge cloak of fear about COVID. And in fact, we've already seen people coming in with delayed diagnoses of breast cancer because hospitals were hard to access. And there was a lot of fear about going in to seek medical care because one didn't want to get exposed to COVID. Now that things have settled out a little bit, many questions still remain, and I'll be covering a few of those. So the first question to ask is, are you at greater risk of getting COVID if you have breast cancer? The answer is not that simple. If you are currently living with breast cancer and undergoing chemotherapy, when your white cell counts go low, you are at increased risk of getting COVID. COVID is a virus, and chemotherapy actually affects the bacteria fighting parts of the immune system. But we have seen that when counts are low, people seem to have a greater risk not only of getting COVID, but of having severe COVID. So we try to avoid your counts going low. And in fact, we've talked in other videos about growth factor. I'm going to spend just a minute talking about those and also have you click to our video about growth factor. So if your counts are low, as I mentioned, you are at greater risk. What we'd like to do is avoid that by using a shot that's given under the skin. This doesn't go deep in the muscle, it goes under the skin, and often there's an on-body injector where it sticks to your body, and 24 hours after your chemotherapy, it automatically gives you an injection. We use that for lots of reasons, but particularly specific to COVID, this is an important part of your treatment plan. What about if you're not on chemotherapy? If you are not on chemotherapy and your counts aren't going low, then we don't actually see a higher risk of either getting COVID or having severe COVID. What about if you had breast cancer in the past? You know, we often think after cancer treatment is over that we're still vulnerable, that our immune system is still suppressed. And that's actually not the case. So this is good news. If you are a cancer survivor with no evidence of cancer in your body, even if you're on endocrine therapy, or it's the same thing, hormone therapy, you're actually not at greater risk of getting COVID or of having a worse outcome. The last case I want to address is, what if you're living with advanced cancer and breast cancer treatment is part of your life? So you're on chemotherapy at times, or maybe off chemotherapy for a break, for a trip. If your counts are low, you are more susceptible to getting COVID, but even more important, having severe COVID. So if you're on chemotherapy on and off indefinitely, you'll want to take special precautions. This isn't just for breast cancer, this is for people with any type of cancer where the bone marrow is suppressed or not at its usual lively self. So if you know people with other cancers and you hear that they're in isolation or they can't be out and about, that's most likely because their immune system is not as, like I said, lively as it would be off of chemotherapy. So I've covered what about the risk of COVID and severe COVID in people with breast cancer. What about the vaccine? Is the vaccine safe? So although the trials that were done of the vaccines excluded people who had cancer and were on cancer treatment, we try to do vaccine trials in a really healthy population. Our use now and our experience with the vaccine in people with cancer is that the vaccine is very safe. Not only that, but it's very effective. So I know there's a lot of hesitation about vaccines in some people, but I would encourage you, if you have cancer of any type, to take advantage of this technology, which was actually under development for over 10 years. So although the approval was hastened because this was a public health crisis, the vaccine actually was under development for over a decade. And I know it's hard to have somebody you've never met tell you to get a vaccine, but everything we have tells us that it's safe, number one, and effective, number two. So in this video, I've covered what the risk is of getting COVID, severe COVID, and the vaccine and its safety, and our recommendation that every single person with cancer or a history of cancer go ahead and get the vaccine. And not just the first one, but the second and the booster. You don't even have to pay for this. Vaccines are available through the Public Health Department. Next, I'm going to talk about how you avoid contracting COVID. So let's say you've had the vaccine, or for another reason you can't have the vaccine. You want to know how to protect yourself. Well, this is great because common sense kicks in. So wearing a mask will protect you. It looks like masks work, but mask mandates aren't as effective, which is interesting. So making people wear a mask when we say, well, when you're eating or drinking, you can take it off, you can see that can be a problem. So in my world, the team that I lead, we ask people to wear masks around people on chemotherapy. Let's do everything we can. It's non-invasive, as unpleasant as they can be. It's much more unpleasant to know that you might have transmitted COVID to somebody going through cancer and its treatment. So wearing masks, hand washing, common sense, staying away from people who are sick, even if they haven't yet had a COVID test turn positive, it's probably reasonable to stay away from people who are coughing, etc. I will tell you at our annual oncology meeting, masks were requested. People took their masks off, and guess what? Lots of people came down with COVID. And this doesn't just include cancer doctors and nurses, but also people who were there as advocates and survivors. So, let's be smart and take care of each other in this really tough time. I know we're all tired of it. I am. Whenever I can, I'll take my mask off. But, it's part of the common good. It's part of what's been called the beloved community, to take care of each other. I know I've covered a lot. If this video has been helpful to you, click subscribe and like. And what that does is it helps other people with the same exact questions you and your family have get the best information out there. If you want to know more about what breast cancer treatment options might be offered to you, go to yerbba.com to learn more.